Have you ever had difficulty holding urine? How about hearing the sound of water rushing from a tap when you have this sudden uncontrollable urge to urinate? It is called urinary incontinence. It is common, it is not normal, but the good news is it is treatable. Physiotherapy can help, and my Physio and I can help you. I'm Ramat Ibrahim of my Physio and I clinics. Today is all about overview of urinary incontinence. Urinary incontinence is an involuntary loss of urine, or let's say involuntary leakage of urine from the bladder through the ureter into the urethra and then outside. It is common but not usually reported due to the embarrassment accompanying with it, and most people are not aware of the treatment options available for urinary incontinence. Also, in elderly people where it is most common, it is perceived as a normal aging process. However, it is not normal. Whether in middle-aged adults or elderly people, it should be treated. There are different types of urinary incontinence. We have stress urinary incontinence, where you have involuntary leakage of urine from exertion, like when you cough, you leak; when you sneeze, you leak; when you jump, you leak; sporting activities, or when you carry heavy objects. Any activities that increases the intra-abdominal pressure leads to leakage of urine. We also have urgency urinary incontinence, where you have the sudden uncontrollable urge to pass urine and you have no choice than to pass it. We also have urinary urgency, where you have this feeling of passing urine and before you get into the toilet you already wet your pants. We have overactive bladder, where you have urgency urinary incontinence. You also have urinary frequency, where you go back and forth from the toilet and you probably urinate more than 10 times in one day. You also have nocturia, when you wake up more than once or twice in the middle of the night to pass urine. All these are overactive bladder because your bladder is not relaxing when it is supposed to. Rather, it keeps contracting and it's not able to hold urine. We also have mixed urinary incontinence, where you have all the symptoms: exertion, urgency, frequency combined in one person. The good news is it is treatable. All you have to do is talk and seek help. Causes of urinary incontinence are weak pelvic floor muscles. When your pelvic floor muscles are weak, you are at risk of having urinary incontinence. You have infections such as urinary tract infection. Also, when there are neurological factors, you are at risk of urinary incontinence, such as when you have spinal cord injury, you have stroke, we have diabetes, when we have diabetic neuropathy. There are risk factors as well associated with urinary incontinence. We have obesity and overweight. We have diets and medications like diuretics. Diets when you have excessive consumption of caffeine and pepper. Chronic cough is also a risk factor for urinary incontinence. Chronic means any conditions that have lasted for more than 3 months. We also have persistent sneezing. We have pregnancy because of the pressure the baby puts on the bladder. We have delivery as well, especially vaginal delivery, because of the stress of the pushing and the contraction. Constipation is also a risk factor for urinary incontinence. Increasing age, as I said earlier, it is common in elderly people. Stroke, depression, diabetes are all risk factors of urinary incontinence. But remember, it is physiological, not necessarily your village people. It is not normal. It is treatable. So all you have to do is to talk and seek help. Thank you very much. Now, subsequent video will be talking about the management of urinary incontinence. I hope you find this helpful. Take care, stay safe, and stay physically active.